Hello, Hosa. My name is Harshil Trivedi.
And I'm Hamidul Islam.
And my name is Gorkem Yurekli. We are the Rutgers Medical Innovation Team with our chapter 12137 from New Jersey.
Hey, Hosa. I will be talking about our idea for Hosa 2020's medical innovation competition. Our idea is essentially going to take technology from this here, Apple's wireless AirPods, and applying the wireless portability and charging features to make a rechargeable 12-lead electrocardiogram. The EKG also comes with an app which you can monitor. Physically, our device will mainly utilize two aspects of the AirPods.
Now to begin, inside this AirPod is a W1 chip which handles audio as well as a Bluetooth wireless connection. We'd also use a similar chip to gather electrical signals from our 12-lead system and transfer that information to your handheld device. The next aspect we will reflect in is our own device, is the battery. The battery inside is very lightweight and a small lithium-ion battery, which can operate to up to 24 hours of listening time.
With that battery, we will be able to have enough time for the consumer to get multiple uses throughout the week. And with the electrogram device runs out of charge, you can simply place it within its a wireless charging case, similar to an AirPod, which transfers energy from the charger into a small receiver inside the device via electromagnetic induction.
Thank you,
So,
Ham.
yeah.
I'll be further going into the design and configuration of our innovation. Using the design of the current ECG electrodes and incorporating it with the composition of the Apple AirPods, we will provide wireless and rechargeable compatibility to our device. The action potential created by the contractions of the heart spreads electrical currents from the heart throughout the body. The spreading electrical currents creates different potentials at points in the body, which can be sensed by electroleads placed strategically on each limb and around the heart. The electrodes are biological transducers made of metals and salts. In practice, 10 electrodes are attached to different points on the body, on each limb, and around the heart. A biopotential amplifier is included in each electrode to process the signals and amplify each potential reading, and reduce the amount of noise or interference received from the body that aren't the electrical impulses from the patient's heart. The information received from the electrodes placed on the patient is then transmitted to the patient's phone, where the ECG app will be able to display the patient's cardiography. The W1 chip, as mentioned earlier, will provide the Bluetooth compatibility from the electrodes to the patient's phone. Each electrode will be in sync with each other, but they will only be able to transmit an effective signal when they are placed on the patient's body. The lithium-ion battery component of the electrode will provide it with its own power as well as rechargeability feature. To display to you our prototype, I'll further be using CAD, where I've designed the prototype with my group to further be able to demonstrate the functionality of the electrode. The biological transducers made of metals and salts are placed at the head of the electrode, where it binds to the sticker, on the underpart where the yellow around the sticker, to read the electrical impulses from the patient's heart. The W1 chip, the lithium-ion battery, and the biological amplifier were then strategically placed and included to maximize efficiency and visual please to the customer purchasing our innovation. Each electrode is placed on one of these stickers.
Share. Oh, here's the sticker.
Thank you, Ham. So these stickers, which are disposable, have a gel coating to increase the signal transduction. Each electrode can be placed on any wireless charging platform, similar to many new phones and watches today, so that each electrode is able to recharge. The included app which displays each electrode's battery life. I will now let Gorkem discuss the research and studies performed which support our innovation and its application to the medical field.
Thank you, Harshil. So I'll be discussing the specific scientific principles of our innovation as well as a very important application of it. As you know, an EKG, or an electrocardiogram, is a device used to visualize electricity that runs through the heart, but specifically it shows how the depolarization waves move throughout each impeding heartbeat, which is in the wave of positive charge in the form of a deflection. And the way it looks on the graph depends on the sets of electrodes you use. An EKG chart can show you of an impeding heart rhythm or signs of a previous heart attack. Now with that, our innovation can also be vital in the realm of sports, as evidenced by this 2019 study using electrocardiograms in NCAA athletes. Now this study here analyzed cardiogram screenings for over 5,200 athletes in lieu of the most common threat to athletes, SCD, or sudden cardiac death, which is responsible for 75% of all fatalities in young athletes during sports and exercise. They compared the different criteria for these screenings in Table 1 in the chart and found that the international criteria for ECG interpretation reduced the most number of abnormal and false positive ECG rates without any loss due to sensitivity. Now, our innovation makes use of the screenings possible within the actual game and run of play, and if we can utilize the best criteria and our Bluetooth capabilities, we will be able to track heart activities in athletes during the game.
All right. Thank you, Gorkem. So in regards to benefits and application, the question needs to be asked, how is this different from the EKG leads we have now? And more importantly, why is this beneficial to the medical society in general? Currently, the most common EKG leads are the portable 2 lead, portable 6 lead, and the in-hospital wireless 12 lead EKG. However, each of these devices have their flaws. Even though there are wireless EKG leads in the market, they're not truly wireless. All the actual leads themselves are connected to wires. For example, the 12 lead EKG called wireless because it can send the information to a healthcare provider via Bluetooth, but it doesn't provide a lot of distance for outside hospital care, which is what we're striving to look for. In addition, the portable smaller lead devices are not much better. Even though these have a much better range, they can only detect so much information. A 12 lead is able to detect more problems within the heart for patients. If a portable lead detects any problems, it is very likely the patient will have to come to a healthcare facility to be hooked up to a 12 lead anyway, delaying patient care. With our technology, we are able to combat all these problems. Our device is mainly designed for patients that need to be thoroughly monitored outside of the hospital setting. The utilization of the AirPod to make leads that are rechargeable and truly wireless allows those patients to be more mobile at home, thus improving the quality of their life. And lastly, since our technology of the AirPods and Apple Watch are so compact and efficient, it allows for the creation of a truly portable 12 lead. So not only is the patient able to be more mobile, but their heart is better monitored than before. The healthcare provider can have access to more information much faster and without sacrificing the quality of life for the patient. So again, thank you for listening to our presentation on Hosa Medical Innovation 2020.